Hello everyone, I'm Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis, and welcome to another video. In the last video I talked about the 3 key essentials to reversing type 2 diabetes. In today's video I'm going to go over the 2 different treatment approaches that are most common to helping diabetics. So we're going to talk about the conventional approach versus the functional approach. Conventional approach is where most patients come from before coming to see me. So they've already went to their doctor. Usually they have a primary care doctor. Some of them have endocrinologists by the time they get to see me. They've been diagnosed, and once they're diagnosed, the first recommendation is typically lifestyle recommendations. And those lifestyle recommendations include changing your diet, losing weight if you're overweight, and including exercise in your lifestyle. Now at that point, you may be left just with those recommendations, or you're prescribed a medication. The most commonly prescribed medication to start off with is metformin. So if you're a type 2 diabetic, I'm sure you're probably familiar with metformin. And maybe you're prescribed a 500 milligram dose in the morning and 500 at night, so 1,000 milligrams per day. You're told to go make those lifestyle changes, and then the doctor will check back in and see how you're doing in 6 months. Now what we see that is a very common scenario is that initially those changes will suppress those numbers. The medications will help suppress those numbers, but what they're not doing is they're not treating those underlying root causes, and so over time those numbers and your body starts to adapt, and the numbers start to creep back up out of range. And when they get back out of range, you go back into the doctor's office, they see that they're out of range, and the next line of defense is usually more medications. Maybe a higher dose of metformin, maybe they add another pill to the mix, but it's more medications at that point, and you're also told once again that you need to change your diet, you need to lose weight, you need to exercise. Now, many patients that come to see me that are diabetic, they've also been prescribed at some point in this process with high blood pressure. So with the conventional approach to high blood pressure, usually a prescription is added to the mix for blood pressure. Many of the patients that are diabetic in the conventional approach, if you have high cholesterol, once again you're prescribed another pill for that. So blood sugar, blood pressure, cholesterol, and told change your diet, lose weight, and exercise. Now at a certain point in this process, if these numbers continue to progress, if your blood sugar numbers continue to go up, you're going to reach a point where you max out on the pills and the doctor will only go so high. So at that point, the doctor will probably start recommending insulin for you. I just had a patient that came in this morning. She's on 2 different types of insulin. She's on a long-acting, she's on a short-acting. She's taking 1 injection of 70 units at night. So she's on 70 units of insulin, a lot of insulin, plus she's injecting 3 different times with her meals, anywhere from 10 units to 20 units. And so that is the last step in the conventional approach. That is really their last tool that they have in order to address the high sugars. Now when I see a patient at that point, it's usually they have many different functional imbalances going on. So when I'm talking about any patient who has been diagnosed with type 2 diabetes, there's different functional imbalances going on. So I want to switch over to the functional approach and talk about, this is our approach in our office, is we take a functional medicine approach, which, number one, we want to ask the question, why does this person have high blood sugar? So, or high blood pressure, or high cholesterol. We want to know why. And one of the things we discuss at the Type 2 Diabetes Solution Seminar, if you're watching this and you're a Type 2 diabetic and you haven't been to our seminar, I would definitely recommend you come, because one of the things we discuss is we get into all of the root causes of this disease. We go through organs, glands, and systems, and we talk about and educate you on all the different parts that help to regulate sugars. And so when I talk about why do you have high sugars, that's what I'm talking about. I'm talking about let's look for the root causes. Are there issues with glands, organs, and systems? And if you're a type 2 diabetic and you're walking into my office, you've got some dysfunction in the body that we need to correct. And just, putting a Band-Aid on this problem temporarily isn't going to fix those causes. we need to actually get down to the root of what's causing it. So that's what we do in the functional approach. We identify the root causes. Once we address, or once we find the root causes, we address them by individualizing a plan for you. So we tailor and personalize the plan, and everything we do, it's all done through natural medicine. So when I talk about lifestyle changes, natural supplements, so vitamins, minerals, and herbs, and all of this is customized and personalized for what your body is telling us it needs. There's no one cookie-cutter nutrition plan that is going to be right for every type 2 diabetic out there. There are some fundamentals that are going to apply to all diabetics, but to really hone in on your specific condition and to really optimize your health, because that's what we're talking about. We want to optimize your health. Now, if you want to take it to the next step, that's when you would come to one of our seminars. So we have type 2 diabetes seminars where we get into more details and really educating you on more about these two different approaches, but more about how you can take control over your health and optimize your health. And at the end of the day, reverse type 2 diabetes. We see patients do that every single day in our practice. So, hope you enjoyed today's video. If you liked it, go ahead and give me a thumbs up below. Also, if you haven't already, subscribe to our channel. And if you have any comments, or if you have any questions, or if you have something that you want me to address in a future video, go ahead and put it down below. And I'll see you in the next video.